Good evening. Welcome, everybody. We are so proud to have y'all here at Clinton High School in the Clinton School District, the best school district in the state. In case you don't know me, I'm Jay Chalk, Superintendent of Clinton Schools, and I have the honor, and I did, Governor, in 2016, I had the honor of introducing the governor in his hometown of Gravette, Arkansas. Here we are in 2021, and I get to introduce the governor in my hometown of Clinton, Arkansas. And so without delaying anymore, our governor of the great state of Arkansas, Asa Hutchinson.
Thank you, Jay, and thanks for the hospitality. It is great to be in Clinton. It was fun to go around and visit with so many that have come out here tonight. Well, what a great crowd. And I hope that some in the back, we got chairs. It would be helpful if we could fill in some of those. We got maybe some more people coming in. But I just got to speak to the Clinton High School football and basketball teams and talk to them. And it's really exciting to see their good questions and how those young athletes are getting prepared for this year. But what I'm doing in my community COVID conversations is just having an honest conversation. And we've been to over a dozen cities across Arkansas. Our vaccination rates have gone up over 40% since we started these conversations. And what is very clear early on is that people are tired of the government telling them what to do. They got to make decisions for themselves, and it's about listening to other people that you respect in the community, your doctor, your nurse practitioner, those that you trust, and getting accurate information. And this is a thought-free zone. That's not the right way to phrase it. I wanted to say a guilt-free zone, that you can ask a question that nobody's going to be critical of. We want to hear the questions. If you have reservations about it, a concern, we want to hear those. Hopefully we can provide some answers. But this is what community conversations are about. We just ask that everybody be respectful of each other, as I know you will, and that we ask a question and then we listen, and then we'll go to somebody else to go to the next question. I really appreciate Senator Mark Johnson, who's here, and he represents this area. Who else? I can't. Oh, Representative Josh Miller. So give both of them a round of applause. Thank you all for being here. And I do talk for a few minutes here, and then we'll turn it open. But I like to set the stage as to where we are here in Arkansas right now. And let me start by put it in historical perspective. June 7th, which is what, less than 2 months ago, right at 2 months ago, June 7th, we had about 1,600 active COVID cases in Arkansas. Today, August 9th, we have almost 23,000. If you look at the new cases, June 7th, we had 62 cases. Today, we had 995 new cases. Now, 995 was because it was a Sunday. If you look back a few days ago, we had over 3,000 in one day. If you look at hospitalizations, which is the greatest concern, we had 175 hospitalizations on June 7th, and August 9th, we have 1,376 hospitalizations because of COVID across Arkansas. You can see the dramatic shift. Now, last June 7th, people say, well, what happened? Well, first of all, that's when we thought we were out of the woods. I felt comfortable in signing the law that said we're not going to have any mask mandates, we're not going to have any requirements on that. And of course, I've said, well, maybe that was a little bit early, because nature threw us a curve and came back in very fast fashion with this Delta variant. And of course, at that time in June, we had the vaccine, so the solutions were easy, is just get the vaccine and we're going to come out of this very, very well. but two things happened. One was the Delta variant, which is more transmissible than the original virus. In other words, it's easier to catch it. And then secondly, the consequences are more severe than the original virus. And so it's, you know, the original virus was enough, but you see younger people in the 40s going to the hospital now. And that's not something that we saw earlier to any extent. And so it's more severe and it's a strain. The second part of the challenge for us is that our vaccination rates are low in Arkansas. And I want to illustrate this a little bit. I set as a goal that by July 30th, which is already passed, that we would have 50% of our population in Arkansas vaccinated, at least by one dose. Well, we didn't make it. Now, 14 counties did make it, so I'm proud of that. We've had 14 counties that got over 50% vaccinated, but not everywhere was that the case. And let's just look at the counties here in this area, starting with Van Buren County, and I think we're going to put it on the screen. I hope dim the lights a little bit, we'll show this. And so let me get you oriented. On the right, you see the fully immunized is on the right two columns, and the dark is the city of Clinton. And then the light is the full county, Van Buren County. And so this is very unusual because just in every one I've seen so far, and you'll see it in some other slides I show you, that usually the county's rate is much lower than the city. And I think it's because Fairfield Bay might be in it. Do we have the mayor of Fairfield Bay here? I saw him on the list, but I think that might skew the county a little bit because it's a little bit more of an urban area. But you can see we're not anywhere close to the 50%. And if you add the fully immunized with, on the left, the partially immunized, you're going to get up to about 40% of the population immunized here in Van Buren County. It's actually 42%. So we're on the lower end of the state of Arkansas. Now let's look at Searcy County. You add those two together, it's about 39%. Actually, that's, Searcy County. You've got a 40% rate there. If you go to the next one, Stone County, you've got to add those together, about 38% fully or partially vaccinated. Cleburne County, you see that, you add those, 45%. Faulkner County, 50. Now Faulkner County got to 51%, which thank goodness because they're a population center. And then Conway County, 53%, and Polk County, 47%. So that gives you a little perspective of this area and how we're doing, which is not as well as we should, right? Now, what's even more challenging for us if you compare Arkansas to the nation. So not only is Van Buren County behind Arkansas, but Arkansas is behind the nation. And the nation's at a higher vaccination rate. And you look at some states, Vermont, 68%, Massachusetts, 64%, Maine, 64%, Connecticut, 64%, and Rhode Island, 62%. Now, and there is a correlation between their cases and their hospitalizations versus here in the South. In the South, look at Alabama, 35%, Mississippi, 35%, Arkansas, 37%, but we're going up. And so we've got a ways to go. That low vaccination rate is a challenge for us. Now, before I turn it open, I want to just lay it out, some of the things that I've heard. I have Dr. Delahaye here, who is the state epidemiologist. And she's a, I just wanted to say you're a small lady with a loud voice. I don't know if that's the right description, but she's a firecracker. She has really helped us through this pandemic, and she's been at it a long time. But she'll be helpful to answer some questions, but these are some of the things that I've heard. First of all, that many women don't want to get the vaccine because they believe it will reduce their fertility. It will make it harder to have children. And I want Dr. Delahaye to address that quickly. Dr. Delahaye, would you address that?
Sure, I'll be happy to. Let's see, make sure we get this on. All right, is that better? Great. So at this point in time, there is no medical evidence that the vaccines affect fertility. It's all over social media, but it's not in the medical literature. In fact, just recently, because of this belief, the American College of Obstetricians and Gynecologists, the OB-GYNs Association, as well as the American Society of Maternal and Fetal Medicine, both came out with strong statements recommending the vaccine for women, not only women who would like to have children in the future, but also for pregnant women, because we don't see women in the hospital who are pregnant because they got vaccinated. We see it because they got COVID, and some of them have had to go on heart-lung bypass machines. So we strongly recommend that everyone get vaccinated, including women who would like to have children in the future.
All right, so I've got a couple more questions. The second objection that I've heard through these town hall meetings and on social media is that there's something about the vaccine that allows mind control. And so, Dr. Dillehay, what do you say about that?
I don't think I have an answer for that. If the vaccine could control people's minds, then everyone would be vaccinated, I would think.
Well, that's an interesting response. But there's obviously, that would be a huge conspiracy. And in terms of the women, those are very serious questions. And Dr. Dillehay answered it, but I would encourage you to go see your physician, somebody that you trust, and ask those questions. Then here's a serious medical question, though, and that is some people say that the vaccine itself makes you give off the virus, and therefore the vaccine is the heart of the problem. Can you respond to that?
Yes. So there is no virus in the vaccines. So they can't give the virus to you for you to give off. Now, what we have found with the Delta variant is that we do have people who are fully vaccinated who have what we call breakthrough cases. They can still get infected. Fortunately, the vaccine works well and helps keep people out of the hospital and helps keep them alive. But those people who are fully vaccinated can still transmit the virus. The reason is that the Delta variant, when people get infected, it's in their respiratory system, and they give it off when they cough or sneeze or talk or sing. It's the droplets or the aerosols. The level of virus, what we call the viral load in the respiratory tract for the Delta variant, is 1,000 times higher than it was for the original Hunan variant that came through. So it's much more infectious, and people who are fully vaccinated and happen to get infected, it's a minority, very small numbers, but they could still spread it.
Thank you. All right, so I did want to thank our mayor that's here. Where's the mayor? Thank you for being here, our county judge. Thank you. Y'all are key to this. I know we have other counties that are represented as well, but we have a lot of our elected officials here. We got city council, we got quorum court members as well. And, you know, the question to the community is, one, let's have a conversation about vaccines, and also what's the reason for hesitancy? What more can we do? Is there more that we can do better at the state level, more that you can do better here at the community level? So I hope we can have that as part of it as well. But with that, thank you for being here, and I want to turn it open, as this is a conversation to you, and be glad to recognize anybody that's got a question or a comment to make. Yes, right here. And we got a microphone coming.
I'd stand, but I'm not able to. I'm a 100% disabled veteran, wartime, and yeah, I don't have any claim to fame and don't want any. Never have cared for it. That's the reason I'm in Clinton. I know veterans all over this state, and they know me. You got an army here already. They're on the ground, and they're working, and they're veterans. Some of them are committing suicide. Masses. Many of them are getting COVID in the line of duty. I'm not the smartest man in the world, never claimed to be, but I was smart enough to have a pilot license before I had a driver's license. I was smarter enough to graduate from college after military service, and I have an A in statistics. Governor, I appreciate you, and I appreciate what your health expert just told us. But, sir, your statistics are based on populations that I question. For statistical analysis is no better than the population upon which it is based. Sure, there's a difference or variation in percentages and seriously, but my God, look at the variation in population. And also, 80% of the people in Clinton and the surrounding area were disabled long before the virus got here. Age has something to do with that. A lot of respiratory conditions, many of them in nursing homes.
Yep.
I could barely make it from the car to this building with this mask on, but I feel that I'm still a public servant, and I'll serve the government till the day I die, but on behalf of other veterans, nobody else. I don't care about party affiliation whatsoever. I want to help the man that's standing on the ground.
Thank you.
They help me, and I'm going to help them to the day I die. But let's not lie anymore. Let's tell us the truth. Tell us what you really know. Tell us the truth about the Delta variant. If you know so much about what it can't do, how do you know that much? If you know that it will not affect pregnancy, where is the evidence that you have collected in the laboratory to prove that? Have you tested 3 times to actually make certain? Has social distancing, does that have anything to do with that?
Okay, let me go ahead. Thank you. First of all, thank you for your service in the past, in wartime, as a veteran, but also continuing to serve our veteran community. And your first point is well taken, that whenever the virus hits, it deals with the population. Some are infirm, some are elderly, some have underlying conditions, and it impacts them all in very, very different ways. And the first variant, or the first virus that hit us, impacted the elderly primarily, and we're seeing, one, they've got vaccinated, so they're not getting hit at the same level, but now we're seeing, and these statistics are available on the Department of Health website. If you don't like the statistics that the state keeps, go talk to your hospital, go talk to doctors who can tell you about the COVID patients that are in the hospital and how they're struggling with space. And so you can get the statistics just by talking to people who know and deal with this every day, if you don't accept the statistics that's offered by the Department of Health. But there is a variation there, but you know, what we have seen, and I asked them to check it today, is that of the new cases that we're having, almost 20% of the new cases are adolescents, 18 and under. And I asked them to check it because that was a statistics that was cited yesterday nationally, and it caught my attention, and I asked them to check it, and they verified it was like 19.8% here in Arkansas of adolescents. Now, that doesn't mean they all go to the hospital. That just simply means that they get the virus and they're a case. But we also see from Children's Hospital that we do have real young people actually having to go to the hospital because of it. Even though it's a small percent, it breaks your heart every time that happens. Thank you for your comment. Let me go to somebody else. Yes, sir.
I think we ought to be more like Florida and this is a respiratory thing. I don't think we ought to be pushing a vaccine that is for emergency use only. Let's be pushing some vitamin D on some kids. You know, let's push some stuff that's legit. How long does it usually take to get a vaccine through? 15, 20 years? 5? Well, and we're trying to push one through in a year and give it to our kids? We got to think about our kids.
All right. Excellent. Thank you for raising that. First, you said we might ought to be more like Florida. First of all, both Florida and Arkansas are open for business. Both Florida and Arkansas have no statewide mandates. Both Florida and Arkansas have no vaccine mandate. And so there's a lot of similarities there in the freedom that each individual has. And so the government's not going to be making you tell you what to do or making you what to do. We're going to have these conversations. In terms of the emergency use authorization, you're right. We do not have final approval by the FDA at this time. I talked to the White House today. We're all waiting for the final approval from the FDA. I think the FDA did make a statement that they expect that to happen within the next 3 weeks. And that's just an example of them looking at all the data before it happens, before they make that final approval. So it is emergency use authorization. Some people advocate for, what, hydroxychloroquine? But is that an approved FDA treatment?
Not at this time. They initially authorized it under the emergency use authorization, and the studies did not look like it was helpful, so they revoked the emergency use authorization for it.
So I guess my only point is that we're used to utilizing, in fact, President Trump utilized medicines and therapeutics that had only emergency use authorization. We want to have access to those drugs that save people's lives, and that's the reason they have given that with a great deal of data and study with all of the 3 different vaccines. I do expect FDA approval. We'll wait and see when we get that. But I think the statistic that means a lot to me is that if you look at hospitalizations, 97% of the people who are hospitalized, 97, 98% of the people who go into the hospital because of COVID, they have not been vaccinated. And so that tells you a lot about the risk of not being vaccinated versus what is the experience of people who have been vaccinated and the health consequences of that. Great question. Did you have anything else on that? Let me go on around to another question or comment. All right, where are you? All right, the question about mask mandates for school. There is no statewide mask mandate that you have to wear them in the schools. It is each individual school, through their elected school board, can make the decisions in their community and in their school as to whether they're going to require masks to be worn by the children, what the circumstances, all of those can be determined by the local school board. So Van Buren School District, do we have any school board members here? I bet you didn't want to raise your hand, did you? But you know, and even the city, and you know, the city can make a decision. And I think that there's going to be, many of the rural schools are not going to require it. Some of the urban schools will because of the density of population. Where I come down on it is that everybody, if you don't want to wear a mask, if you don't want to have that, that's fine. Just get a vaccination. But there's one age group, only one age group that can't get a vaccination, that's 12 and under. And so I believe that to protect children 12 and under, school districts should have the option of saying we're going to have masks for those children, but it is their decision. There is no mandate right now.
There's an option when the federal government cuts off funding and you decide that you need the funding instead of letting your citizens make decisions for themselves. You tell the school board what they have to do or they don't get funding, and then they do what the government tells them to do instead of making their own decisions.
Well, I would be opposed to that.
It happened last year
Uh,
all over the state.
No, there was not any funding cut off.
There would
If-
have been if they had not followed the mandates that were put forth.
We did not cut off anybody's funding, and so,
Odd, but you would have had they not followed the mandate that you put forth.
well, there's no statewide mandate. I'm opposed to a statewide mandate. I believe it should be up to the local school districts, and I would oppose the federal government withdrawing funds from any school district because they don't like what happened. All right, we got a lot of hands that were up. Where's the next one? Yes, sir.
Just one question on some of the treatments that you said were authorized at first and then withdrawn. They are authorized for other treatments, though, are they not?
Well,
And have been
so they're licensed, they're fully licensed for other treatments.
for other
That is
treatments. So
correct.
they've been used for years. So
Yes.
I just wanted that, and you asked a question about what could maybe your office do better, and I'm not sure. I haven't seen all of your press conferences and things like that. But I will say this.
You're lucky.
Well, I don't envy your position. Aside from politics, I don't know if there's been anything that's been created more animosity between people than the vaccination and unvaccinated. And I'm just wondering, when you do your conferences, is there some way you can address that? I mean, you got people that are saying that those that are unvaccinated are not compassionate towards, they don't care about other people. You got one elected high office saying that we're less smart. Well, I just gave it away that I'm unvaccinated. Things like that. And I just wonder if there's not an opportunity for you as you're addressing communities and the state to address that. It's like, because I'm sure you feel like some ways you're spinning your wheels sometimes, because some people are going to leave here and maybe they're going to be convinced, but a lot of people are probably going to leave here and not going to change their minds. And so, I mean,
Sure.
that divide is horrible.
It is. You're absolutely right. It's not just about the vaccines, but also about masks. And I'd love to shift the debate to vaccines because, what's a governor supposed to do? Because, first of all, we have people dying in Arkansas, and we want to have school. I want to have a very successful school year. I love sports. I want to have people in Razorback Stadium and in all the other stadiums across Arkansas. And so how do you get there? One, do I listen to the medical experts and the epidemiologists, and they know what they're doing, and I do listen to that. Now, I do overlay that with the wisdom that I have from my background and what people can accept and what is the right message. So I don't just accept what the Department of Health says and saying that's what we've got to do as a state, but it's an important factor. And like early on, I wanted to keep all the businesses in Arkansas open, and I refused to shut them down. I refused to put restrictions out there. I wanted to open everything up. And one of the ways we did it was to encourage mask wearing because that kept us open because we didn't have a vaccine. We've moved beyond that. Now we've got the vaccine. I want to be able to heal that divide, and part of it is, I believe vaccines are important. That's why I took it, my wife took it, my children have taken it, and my grandson who plays basketball has taken it because he doesn't want to be quarantined. And so I believe in it. I respect those, and you conduct yourself so well, and you're very articulate, and you're smart. And you have your views on it, and I respect that. And so I think that's honesty, but I do need to go out and at least make the case as governor that if we're going to get back to normalcy, I believe we need to think this through. And I'm not asking you to trust the government. I'm not asking you to trust me or the Department of Health. I'm asking you to and everybody to talk to somebody you trust and think it through, get as much good information as you can. Excellent, excellent question. Yep.
And I understand that. My thing is, I just wonder if there's an opportunity for you to try to be a peacemaker, within our state. It's frustrating to watch people attack each other over whether or not they're vaccinated, not vaccinated, wearing the mask, telling Arkansas they're, one of the dumbest states in the nation because, we've got the lowest, or one of the lowest, or highest.
Yeah. We're moving up. All right. If you've got some ideas on how I can bring people together, I welcome that.
Say it from your press conferences, it's like, that's what I'm wondering.
Well, I hope this is an occasion that people come together. All right, we got some other comments. Yes, way back in the back. And by the way, thank you all for being here. Introduce yourself.
So I'm Miranda Bryan. I'm pharmacist in charge at Clinton Drug. Jenny and I are here representing the community, offering vaccines today. While we were standing here waiting for the conference to start, I had 3 people come up and ask me about the booster. Are we going to get a third booster? And if Dr. Dillahay could just take a minute to address that, because we have a lot of people, we get barraged with questions every day, but I would say that that's one of the main ones that we're hearing right now. If you could just touch on that, please, I'd appreciate it.
Yep, Dr. Dillahay.
Sure. So a booster would be needed in one of 3 situations. One is people who have weakened immune systems and they may not respond as strongly to the doses of the vaccine as they're currently recommended, 2 doses of Pfizer, Moderna, or 1 for Janssen vaccine. So maybe an additional dose would be recommended for them. The other situation would be if over time, people who are fully vaccinated, if the immunity that that vaccine provided waned, and then it increased their risk for getting infected. And then the third one would be if we had a variant that came through that the vaccine didn't cover very well. We're fortunate in that the vaccine still works pretty well on the Delta variant. But right now, we follow the Advisory Committee on Immunization Practices recommendations for vaccination. And there is no recommendation at this point in time for boosters. We believe that a recommendation is likely to be made and clarification of what the plan is next month. And so hopefully we will be able to provide more detailed and clear guidance about booster doses. Who is recommended to have them? Does it need to be with the same vaccine you had before, or can it be different, and so forth? So all of that is forthcoming, and I hope within the next month.
Thank you. Thanks for raising that question. Yes, ma'am.
Has the virus actually been isolated, and can you really call this a vaccine? Is this a vaccine? Are we getting something of the virus in our bodies as an immune response?
Dr. Dillahay?
Sure. So the vaccines work by teaching the immune system about what the spike protein looks like. So if they see that spike protein on a real virus, the immune system has already gone through the steps that take some time to be ready to fight it. The mRNA vaccines do it by teaching the cells to make the spike protein, and then the immune system recognizes it. And that only lasts for a day or 2, and then the immune system is ready. It takes the immune system a few weeks to go through that process of establishing its immune memory. There is no virus that causes COVID-19 used in the manufacturing of the vaccines, and no viruses that cause COVID-19s are in the vaccines.
So how can you call
Okay. Okay, so how it's, well,
All right, the
Yes.
question is, how can you call it a vaccine if it works differently than historically vaccines
Yeah.
have done?
Correct. And our body is wonderfully made to fight off all kinds of, attacks.
All right, thank you.
okay. So we call it a vaccine because it does what vaccines do. There are several different types of vaccines, and this is one of them. For the mRNA vaccines or the Janssen vaccine, which is a adenovirus vaccine. So we have other kinds of vaccines that you're accustomed to. Some of them just have a protein from the virus or the bacteria that we're used to, and we give that to the person in the shot. Some vaccines are weakened viruses that don't cause illness, but they stimulate the immunity. That would be like the measles, mumps, or rubella viruses, vaccines that protect against those diseases. So there's several strategies for how to teach the immune system to be prepared for encountering the real virus or the real bacteria. They're all vaccines. They all meet the same requirements for clinical studies and efficacy and safety. They're all vaccines.
All right, next question or comment. Yes, ma'am, right here.
What happened to the plague? I don't hear anybody that says, oh, I've got the plague. It's always, I've got the virus. So I'm just curious, what happened to the plague?
So we have seen around the world, this last flu season was very mild, and we believe it has to do with the fact that masking and social distancing and the things that we did to prevent the spread of COVID-19 worked also very well to prevent the spread of the flu. We've seen this also for other respiratory viruses. Right now, for example, young children are especially vulnerable to RSV, which means respiratory syncytial virus. We had hardly any this last winter when we usually have it, but now that we're letting up on the restrictions, we're seeing an increase in flu as well as an increase in RSV.
All right, I'm going to get my continuing medical education credit right here tonight. Thank you, Dr. Delahaye. We had some other hands up. All right, who's next? Shaylin. By the way, Shaylin Sowers is right here. Wave, Shaylin. She's a graduate of Clinton High School, played basketball here. She's my communications director, and she insisted upon me coming to Clinton, so we're back home for her.
Hello, Governor. My name is Jerry Cabana, and I'm a nurse and a veteran. Thank you for your service. I'm also a mother of 2 children that you spoke to over there and encouraged to get the vaccines. I really feel that's a parent's job to research the vaccine and make that decision with their child, not to be coerced or pressured by the governor coming in and telling them that there's no adverse reactions, which I heard you say. I also, as far as the PCR test, I heard it does not differentiate between the flu virus and COVID. So this increase in number of COVID patients, are some of them flu patients or not? Also, I had COVID last year. I was sick for 34 days, almost died. Found a doctor, miraculously, who prescribed ivermectin to me. Ivermectin saved my life. Within 48 hours, I was symptom-free. It seems like it would be more beneficial to make that available to everyone rather than an invasive procedure like a vaccine that has no studies on it. We do not know the long-term effects on our children. We don't know because it has not been around, it has not been studied. So why are those things not available? Why are we not pushing that instead of a vaccine that is invasive? And there are side effects to this vaccine. I am a nurse and I have seen plenty myself.
Thank you.
Plenty.
Well, and if I said that, I apologize, because on the vaccine itself, it has what are the side effects of it. And so that's one of the reasons when you take a vaccine, they usually have you stay there 15 minutes to make sure that you don't have an allergic reaction or something. So certainly that is clear, because that is stated as a potential side effect. In terms of the studies, the vaccines were not even approved for emergency use authorization until massive amounts of studies and clinical trials were done. And so I just would make that point. You're absolutely right about therapeutics. We've got some great therapeutics. When we first started through this pandemic, it was a lot of unknown. We didn't have that. We've developed what works, and they've been approved, and they're working very effectively. But I'll let Dr. Dillahay talk more on, she mentioned one specific therapeutic, and if you had any other comment on what she said.
I would recommend that anyone who treats patients for COVID-19 follow the recommendations of the National Institutes of Health or the Infectious Disease Society of America. They have the best studies. And so I can't really comment on the ivermectin because I have not looked into that for it.
The America's Frontline Doctors, they've got excellent studies, and they have had great success with the
Kids keep saying it had been tested, don't let it. I told them I better check with the Conway VA. I've had both of them. I'm in a research program with at some other veterans office. We're testing vaccinations right now. You don't know we're testing them out. They are being tested. We're testing them. They're testing on us.
All right, I have a question here. Is there somebody else you've identified? All right, so let's go right up here.
I want to know why we don't have any record of how many people that get vaccinated are hospitalized and dying from COVID, and the side effects from the COVID vaccination. I want to know why we don't have reports of it. I'm seeing it all over the internet of people complaining and people losing their kids and their family members over it, and nobody
over
say
what?
anything. Over taking the vaccine.
You losing them in what way?
After they take the shot, they die. They've had cardiac arrest, they've had stroke, they've had limbs amputated because of blood clots, and we're not getting anything on that. We're just getting, take the shot, take the shot. And by the way, Tractor Supply has ivermectin, guys.
What's another word for that?
What?
Ivermectin?
Ivermectin.
Okay.
It's
Is that the dewormer?
Dewormer.
Yeah,
It's a veterinarian supply.
that's what they've been talking about. I don't,
Okay.
Prescribed by doctors for scapegoat.
So FDA hasn't approved that, but that's,
Yeah, but my cattle and stuff live after taking it, and I know people that don't take the shot that hasn't, so.
okay. All right. So,
What I'm seeing, Governor, there's a whole lot of people here that are watching the internet, listening to what the government says, listening to what the TV says, weighing it out for themselves, and seeing that what y'all are feeding us is what you are being paid to feed us. You're not giving us a real vaccination. You're not giving us a real solution to the problem. People are made to get sick. We get sick every day. All kinds of different diseases. God made us to take in these diseases a little bit at a time and build an immune system for it. What y'all are trying to do is push a vaccine that does whatever it does. But y'all can't prove that it helps. Y'all can't prove that it is doing a better job. Oh, our numbers are going up. Okay, so it's because of the new variant. You can name, I've got 3 names. You can name something over and over again until you run out of names. You're
All right.
pushing fear and you're pushing control. And I'm afraid that you're in a room that's tired of having fear pushed on it and tired of y'all trying to control us, down to the point to where, you know, you're out of here this year. You won't be governor of the state anymore. What's the next governor going to do when somebody says, okay, New Hampshire and New York already have to have proof of the vaccine to go buy groceries for their kids? How sorry are you going to feel for the kids that can't get food because their parents don't want to put something that they don't understand into their children's body?
Parents have that option, and parents direct the health care of their children. That's, and no child under 18 gets vaccinated without the parent's consent. That's a system that we've set up. There's no mandates for it. I get.
You're leaving this year. What's going to happen when it gets apart from New Hampshire to New York? It's like everything else works its way across the nation. What's going to happen when I can't go down here to the store and buy my kids groceries because you or your predecessor says that I have to have proof of the COVID shot before I can go buy groceries? I'm afraid it's not going to go your way.
It's not going to go my way, which is what way?
The way that
Well,
you're pushing the vaccine.
I'm encouraging the vaccine because I believe it's important for our state. Ma'am, you don't want me to be here to encourage the vaccine, is that right? Yeah, I mean, I appreciate you coming out. This is something that I think is, you know, rather than me having news conferences in Little Rock, I wanted to come out to a community. I want to be in the cities, so I can. And I know what you've expressed is very real, and I respect you if you're not going to change the mind. I just disagree on some of those points, and I think the medical data supports that. But that's why I'm here, is to listen and to get constructive comments. And you know, if somebody's got a better idea than vaccines to get out of this, and I don't know that. I just don't want to go through a school year where it just runs rampant through our schools. We haven't done anything. All right, so we've got some back in the back. What hands are up there? Let me see your hands if you got questions and comments. So back in the back there is, and who am I missing? Yeah.
I just have a comment, some for the young lady up there. I have a friend who's got a granddaughter with a gene mutation, and several years ago she had coronavirus 13. You know, there are several and I've been led to believe that they've been working on a coronavirus vaccine for years. They didn't just start in January or February of last year. They've been working on this. The push was because we were under a pandemic and they were trying to get it for emergency use. Is that correct?
That is correct. There have been decades of research in mRNA viruses, and they had already done a lot of work working on a vaccine for SARS, the original pandemic that came through in the early 2000s, as well as a disease called MERS, which is Middle East Respiratory Syndrome, which camels carry. So people who work with camels in the Middle East can get this, and it's very deadly. So there was a lot of work, even with vaccines for animals, because of course animals can get coronaviruses. So they knew a lot about what was needed for the vaccine, what the target was for the immune system. And then with government funding, they could change the order in which they did some of the studies. Usually, a pharmaceutical company would do a phase 1 trial, then a phase 2 trial, and a phase 3 trial. And a pharmaceutical company would never move from phase 1 to phase 2 unless they knew phase 1 worked. Or phase 2, unless they knew it worked, they wouldn't move to phase 3. But with the funding that was provided that removed some of the financial risk, then the companies could start enrolling in phase 2 before phase 1 was completed, and so forth. So they completed all of the steps that were needed. The basic studies that should be done for any vaccine were completed. And then the other thing that was done timely is usually a pharmaceutical company will not scale up production of a vaccine until they are approved by the FDA. But in this case, they scaled up production for the vaccines while they were being studied. That was a huge financial risk, because if it wasn't approved or authorized, then they couldn't be used. They would have had to be discarded. So there were things that were done differently to bring the vaccines to the American public, because in the meantime,
Well, it was
thousands of people were dying.
Well, it was President Trump and Operation Warp Speed that
Yes.
brought us this vaccine.
Yes.
And so, yeah, he said, let's move quicker than we ever have moved before.
The only other thing I was going to say is that all these folks that are on the fence about the vaccine, I personally, in a small town, have lost more than 20 people that I know personally, 3 family members, and as I was walking in the door, got another phone call of another death, and none of these folks were vaccinated. So when you see that one-on-one, I don't see how, I know it's not an argument, we respect each other's choices, but I don't see how anyone can see that personally and not choose the vaccine. There's always a small risk, even with a flu shot or the chicken pox. There's always a small risk, but the good outweighs the bad, in my opinion. That's all I was going to say.
Thank you very much, ma'am. And back in the back here, I believe.
I just wanted to follow up with the question that the lady asked earlier about adverse reactions with vaccinations. Jenny and I were just talking, and between the two of us, we've given over 8,500 vaccines across the board of the 3 different vaccines, and neither one of us had had a serious single, reaction that was adverse. We have to report those vaccines to the state, every single one. We have to report every single adverse reaction that we would have. And like I said, we haven't reported any. I was going to see if maybe Dr. Dillahay had information on that as to how many adverse reactions we had had for the vaccine across the state of Arkansas.
So all of the, anytime there's an adverse reaction to a vaccine, it's reported to the Vaccine Adverse Event Reporting System. And all of those you can look at online. The thing you have to keep in mind is that sometimes people report things, in fact, that the vaccines didn't cause. But we encourage everyone to report in case the vaccine could have caused something. So sorry, I don't know the numbers off the top of my head, but I can tell you that all of the serious adverse events and deaths following vaccination are investigated by the FDA and the CDC. And at this point in time, there has been no association with death other than the Janssen vaccine that has the thrombocytopenia syndrome. That's very rare, but there have been some deaths associated with that. And I have, just today I was looking on the CDC website, and it's possible that there was one person that had Guillain-Barré that may have died as a result of the vaccine. But there's lots of other causes of Guillain-Barré, and they're investigating it still.
All right, so thank you, Dr. Dillahay. I've got one thing. I like to keep these at an hour. We're just about there. I've got one ad that I wanted to play that I think tells a good Arkansas story that's important. Is there anything else in terms of a final word or a final question?
Watch your toes, doctor. I've lost one, I got 2 more to go.
All right, so we had, is that a question back here? Yes, ma'am. Just wait, let's get a microphone.
They put a spike chromosome in there so it attacks the COVID. Is that what I understood?
No. The spike, the coronavirus, the SARS-CoV-2 virus, which causes COVID-19, has on its surface some proteins, and they just have been named spike proteins. The virus uses these proteins to attach to proteins on human cells. And when it attaches to that protein, then it can enter the cell and cause an infection. So the vaccines work by teaching the immune system what the virus's spike protein will look like. And the immune system goes through the process of learning to recognize it before you're infected. It takes about a week or more for the immune system to learn to recognize it and get rid of the virus on its own. So you give the immune system, it's like a running head start. It's already gone through some of that recognizing process. So when it sees it for real, then it can block it with what we call neutralizing antibodies, and it cannot attach to the human cells.
All right, let's dim the lights. Let's play this ad.
I'm Anthony Lowry, and I'm from Hamburg. I was an anti-vaccine person until my whole family got sick with the COVID. There's like 10 of us that had it, and there's been 3 deaths. You know, I think back to my younger days, you know, I've done a lot worse things to myself than I think that vaccine would do to me. I don't know of anybody that's died from the vaccine. I got 3 people in my family that died from the COVID. If I'd have known then what I know now, I would have been the first one in line to get the vaccine.
Learn more at healthy.arkansas.gov.
I think you all have been a terrific audience tonight. Please give all of Clinton and Van Buren County a round of applause for just the respect that you've shown one another. You all have really been terrific, and I thank our elected officials for being here. I know, you know, we wanted to hear from the public, but you've listened, and I know that you all will be thinking about, you know, what we need to do in the community, how we can answer questions. We appreciate our pharmacies that are in the back that have vaccines that are available. I respect everybody's decision, but we like to make that available. And talking about, I know bringing people together, I've still been thinking about that. And, you know, whether you support Trump, Trump says he's been vaccinated and he encourages that. You know, the Democrats have stressed that as well. So really there's a unity in terms of support for it, both sides of it. Let's see if we can't bring people together. We respect everybody, but I state my opinion, and I know you all do too. Yes, ma'am. Here. Yeah, and
as long as there's any questions here.
All right, that's a great way to end that. Thank you all very much. God bless you for being here.